So this one is about the placenta acreta, right? So the placenta acreta, we talked about it before. It's the most common cause of the most common cause is uterine atony. We're gonna talk about postpartum hemorrhage in some other video, but this is it causes postpartum hemorrhage. Then acreta, remember, acreta, it can cause from uterus bleeding after you try to take out the placenta. So uterine tetanus, pelvic tetanus, abdominal uterine bleeding. It can present with hematuria or rectal bleeding because remember there is 3 types: acreta, increta, and parcreta. Acreta is just superficially attached to the uterus. Increta is in for invasion. Parcreta is into serosal bladder and rectum. So if the placenta is getting into the bladder or rectum, of course you're gonna have a hematuria and rectal bleeding, right? And this is a abnormal uterine bleeding during pregnancy, or it can present hematuria or rectal bleeding during pregnancy, right? Or it can present with postpartum hemorrhage. So it can present with bleeding during or after delivery. It's painful bleeding. So the biggest risk factor is the previous C-section. So this is a most common risk factor. I've seen they ask this question: what's the biggest risk factor of placenta acreta C-section? Anytime it does damage to the uterus, myectomy, history or DNC, mom greater than 35, placenta previa. Remember, the biggest risk factor for placenta eruption is hypertension. The biggest risk factor for placenta previa is previous placenta previa, C-section, and multiple gestation. The biggest risk factor for placenta acreta is prior history or C-section. So diagnosis is, of course, ultrasound. So if you diagnose antenatally during pregnancy, then you do a planned C-section at 34 weeks. So the goal is you have to do a planned C-section at 34 weeks. Yes. And then, so if it's unexpected occur during or after delivery, it's causing postpartum hemorrhage, right? So you have to give oxygen, fluid, try to stop postpartum with oxytocin. You can try manual traction, vacuum DNC. Hysterectomy is a last attempt. So this one is a little complicated, or like what to do next. So I just try to remember that for acreta, any type of placenta, acreta, increta, or parcreta, the end result will be hysterectomy. So usually they take out the whole uterus and leaving the acreta and distilled, and they take out the whole uterus and the baby. So this is the acreta.